Great. So this month, what I'm doing is I am challenging you to slip out to the drugstore or Walmart and pick up a package of these soft picks. If you currently aren't using anything in between your teeth, the bacteria is getting in between and you just can't possibly reach it with your brushing alone. And so what happens is that bacteria is releasing toxins underneath your gums, causing swelling, and eventually what you'll see is bleeding gums, gingivitis, which left untreated will carry on and lead into what's called periodontitis when you actually start to lose bone that support your teeth. And this is probably one of the best tools that have come around in a long time. It's for cleaning in between the teeth. Has tiny little rubber projections that massage the gums when you're using it in between. Gets the circulation going, really cuts down on bleeding, and then it also works to remove the soft bacteria from in between the teeth and keep the gums that much healthier. When you're using it, you want to bite your teeth together, start at the back, and slowly work your way around to the front in a pattern, and then going up to the upper teeth and going along the same pattern. Where there's maybe some bone loss around the teeth, if there is, what you'll find is this is going to slide a lot further in between the teeth. Towards the front, or where the teeth are much closer together, you may only get it a very small amount, but it is still working and doing its job. So I'm just going to show you how I use it, starting way at the back, biting my teeth together. So what I challenge you to do is the first day I want you to go around and use it. Then I want you to take a look in the mirror and just see if you're seeing any bleeding. If you're getting several areas that are bleeding, your gums aren't healthy right now. So I challenge you to work every day for the next week, and at the end of the week, take another close examination, see if your gums are continuing to bleed. If they are, you're probably in need of coming in for a professional cleaning. There's likely more going on that can't be reversed with just incorporating some home care into what you're already doing. Professional cleanings are recommended on a 6 to 9 month basis for most people. Some people need to come in more frequently to keep their gums much healthier. Gum disease. So I introduced these new tools to you and stress the importance of their use, because when we're dealing with the mouth, we are no longer just dealing with decay and gum disease. What happens when your gums are bleeding is the bacteria that is in that little pocket around each tooth floating around. If your gums are bleeding, that means there's an opening for that bacteria to now get into your bloodstream. And they are finding the bacteria that causes gum disease. They're finding it in the heart. They're finding it in the brain. And they know that there is now this link in between heart disease and gum disease. It is a causative factor. It is also being linked to multiple diseases and conditions, and it's becoming more and more important now that you keep the gums and the bones supporting the teeth as healthy as possible to keep you as healthy as possible. Bleeding gums are not healthy. They can be because of several different reasons, vitamin deficiency, breathing through your mouth, but these are all things that together we can work to decrease and eliminate the bleeding in your gums. Your dental hygiene appointment is so much more than a cleaning. It truly keeps you healthy.